Hi, I'm certified nurse midwife Tiphne Sharpe, and you are watching Ask the Expert. In this month's episode, I'm going to discuss maternal mental health conditions to look for during pregnancy and the importance of postpartum screenings. So some mental health conditions that are common in pregnancy and the postpartum period are postpartum depression, postpartum psychosis, and postpartum baby blues you may have heard of. And there is also postpartum anxiety. So some symptoms of each of those to distinguish the two. Postpartum blues, that's usually not as significant because it only lasts for about 2 weeks, and some symptoms are slight anxiety, difficulty sleeping, and most of the time it's usually related to the hormone shift just after giving birth, and it usually lasts for about 2 weeks. What can be of concern is if the depression symptoms, anxiety is lasting longer than 2 weeks, it's interfering with you performing and bonding with the baby. That's when you're looking at more like postpartum depression. A more severe form of postpartum mental disorders that one may experience, but it's pretty rare, is postpartum psychosis. And that is when women start to hallucinate, start not being able to express themselves vividly, and that requires immediate hospitalization. The risk factors are definitely very related to women who develop postpartum depression. So if you are one who have suffered from any trauma, if your birth experience actually was not a positive one or traumatic, you're definitely at risk for that. Or if you already had a pre-existing depression condition, there is assistance that can be available. Majority of the time, it usually just involves speaking to a professional, and sometimes medications may be necessary. They have plenty of medications that are safe, and moms who are breastfeeding, don't be afraid to reach out because there are options available and that are safe for moms who are lactating. When we talk about screening, oftentimes it is imperative for providers to do a screening during your pregnancy and then shortly after to see if you are at risk for developing postpartum depression, or if we can get ahead of the curve and get you started with therapy as soon as possible. There's been a kind of shame attached to it where people feel that something's wrong with them and don't want to verbally express that they are having a hard time bonding with their baby. So here at NorthShore specifically, we have mental health care providers here in the office. And what's also nice about that option is sometimes you just had a baby at home and you don't want to leave. They offer the option in terms of like a telehealth appointment, so that way you can still be at home but still get the care that you need and speak in a safe space with a provider who is well trained in your needs. Here at NorthShore, we have options for patients who are insured, underinsured, or uninsured. If you're pregnant or have recently given birth and are experiencing symptoms of a mental health condition, call 1-888-313-8557 to schedule an appointment with one of NorthShore's women's health providers. Learn more by visiting our website, northshorehealth.org.